Nice to meet you. I hope that to be easy pass the exam. Of course, the exam is run all over the year and all over the world, and it is simple. And the aim of this exam is to have a candidate who work in the United Kingdom. Okay, okay. Best wishes all.
Okay. So, thank you very much. Best of luck to Dr. Abdul Rahman. Um, we're going to start the 9 minutes virtual OSCE station. And you have read the scenario, Dr. Abdul Rahman?
Yes, I have read the scenario.
You've read the scenario. Okay. We better call you candidate 2201.
Okay.
Okay, because in the Royal College exam, we don't call anyone by their name, call them by their number. You have read the scenario, and
Yes.
you will open the door, and you will have 9 minutes inside. You will find an actor, which I will play the actor,
Okay.
and after that, you will have 6 minutes of taking history, and after that we'll get the question answered. So you can start candidate 2201.
Okay. Hello, I am Dr. Abdurrahman, one of the surgical trainee of the hospital. Could I confirm your name and age, please?
Yes, my name is John Stewart. I am 65 years of age.
Hello, Mr. John. Could I know why did you came hospital today?
I came hostel today because I have abdominal pain in the last 3 days when I was in my daughter's wedding.
I'm sorry for that pain. It must have frustrated you during the party. And congratulations for your daughter.
Thank you very much. It's nice of you.
Okay. Okay. Could I ask you some questions about that pain?
Yes, please go ahead.
Okay. Could you tell me exactly where is that pain?
The pain started in my lower abdomen, more toward the right side, and
Okay.
it is getting worse since that time. And
Okay.
today I felt really very, very bad. So I came to the hospital to see what has happened to this pain because a friend of mine have died. He had uh, he had an abdominal pain and he went to hospital. So I'm a little bit worried.
I'm sorry for your friend and to hear that. Okay. Could you tell me when did it start?
It starts 3 days ago.
3 days ago. Okay. Does it radiate to any place else?
It is radiating a little bit toward my back.
Toward your back. Does it radiate lower?
No,
No. Okay. Could you describe the pain? Is it like sharp or stabbing?
it's a kind of grinding pain in my lower tummy, and it's getting worse. It's not improving by anything I do.
Hmm. Okay. Did you notice anything increasing it?
Um,
Like,
maybe when I move out of bed, it gets a little bit worse. Not much.
okay. So is it associated with any fever? Any increase in your body?
No, I don't think I'm hot. No.
No. Did you notice any vomiting these
No,
days?
no vomiting, but I feel a little bit unwell. I don't feel good appetite.
Okay. You feel your appetite is decreased these days, right?
Yes.
Yes. Okay. Did you notice any unintentional weight loss
No.
recently? No. Um, any problems with your water works?
Yes, I've noticed yesterday that urine was
Like when you
dark,
go to
was
the
very
toilet
dark.
recently
Yes,
with the pain?
yesterday, only yesterday, I've noticed that urine
Only
is very
only
dark.
yesterday.
Yes.
Okay. Is there any swelling in your tummy? Or did you
No,
notice any
can't
swelling?
feel anything different. No.
No, anything different? Okay. Any problem? Was there any problems with your stool, like increase in frequency of stool or
I didn't pass any stool the last 3 days, so I'm
the
not
last?
sure.
Okay. Uh, So how does it affect your daily activity?
I can't do my work. I didn't go to work today or yesterday, and I am in constant pain. And I did take some codidramol, but it didn't work. Unable to continue. That is why I came to hospital.
Okay. Is it associated with any? Is it increasing with fatty meals or anything like that?
No, not really. I didn't have meal in the last 3 days, so I don't feel like eating.
I'm sorry. Okay.
Do you think it can be dangerous, doctor?
We will run. We will run our investigations, and we will do our best to try to help you.
Can it be
Okay.
cancer like my friend?
I know you are concerned about your friend, but it's early to tell something like that. We will do our we run our investigations and to know what is your problem for now. But for now, let me ask you also: do you have any medical condition, chronic condition? You
Yes,
know, you visit your GP
I
for
am
it.
diabetic type 2, and I've been hypertensive. In the last 10 years, I take my antihypertensive medication.
Do you know what's their names or
Yes, it's Concord 2.5 milligram.
okay? And diabetic on insulin or on drug?
I take insulin. I take insulin twice a day.
Okay. Do you have any other chronic problem you visit your GP for?
No, other than diabetes and hypertension, no.
Okay. Did you underwent any surgery before?
I had appendectomy long ago, 30 years ago.
Okay. Mm, do you have you? I have read that you have no allergies about from any thing. That's
No,
right, right?
no
Okay.
allergies, no.
Okay. Let me ask
Okay,
you some questions.
it's now 6 minutes. Okay, so at this part, the examiner will stop you. And the first
Okay.
question is, can you give me a summary of Mr. John Stewart? You
Mr.
start,
John Stewart,
Dr. Abdurrahman.
a 65-year-old male who presented complaining of right lower abdominal pain, which started 3 days ago. Uh, the pain increasing is progressive of grinding character. It's radiating to his back and increasing a little with activity. He is diabetic on insulin and hypertensive on control.
Okay,
He also
what do you think is the cause of his pain? What do you think is the cause of his pain? I hope this is not a electricity blackout.
Okay. What's your diagnosis, doctor? We ask you, what's your diagnosis?
Yes, what's your initial diagnosis, Dr. Abdurrahman? Well, I think, I'm not sure, but there is power cut. So let me take the opportunity. Number one, you didn't write down, Dr. Abdurrahman, all the information. And in this station, you always have a paper and pen. And most Egyptian doctor and Middle East doctor are used to take a history verbally. They don't write it down. And when they write it down and then stop. Let me start by the comment of my colleague. I think there is cut down of Dr. Abdurrahman. When he join in,
Okay.
we can, but at least we got his 6 minutes. You as an examiner,
Okay.
Professor Shireen, what's your
Okay.
comment?
Yes. First, he is good in discusses empathy, because when you discuss that, you have wedding and you have someone die, so it is good mark for him. But when he analyzed the pain, he mentioned that radiation, duration, what increase the pain, and he miss what decrease the pain, and he don't ask about pain score. So he need
Yes.
to ask if you any pain, you need to ask about the site of pain, duration of pain, radiation of pain, what increase the pain, what decrease the pain, and the pain score. He missed pain, what decrease, and the pain score.
Yes.
Second, I think some Middle East doctor, I am live in Malaysia. He asked some like he asked about what is water work. It is urine is common word in English, so he can ask about what is about your urine. Don't say
Yes.
something silly. We are not in movies, so we don't
Yes.
ask what is water work. It is not good question.
Yes.
After that, he not ask about social history and alcohol, one of the
Exactly.
common cause of pancreatitis. So he need to ask social history. He don't ask about family history.
Yes.
When he asked about medical condition, he asked, "Are you have a medical condition?" And in exam, we consider it is wrong. You need to ask if you have any medical condition like hypertension, diabetes mellitus, dyslipidemia, or bronchial asthma. Maybe in your country some other disease. I don't know it. This is a comment, but this is comment because in exam we have a competition. We compare the student to the other. So
Yes.
his history taken is not so good in comparison to other because it is comparison exam.
Yes.
But it's still like we consider as borderline if you need to ask how to score him, so he can be borderline. Of
Yes.
course, he asked some question not related, and he asked about detail of medication, which we don't need to ask about, like what you take for hypertension, for diabetes, and this is cut from his time. So it
Yes.
is important to concentrate of the related topics like alcohol, smoking, family history. He
Yes.
don't ask even about other system, which is important, like you
Yes.
have shortening of breath, palpitation, any other problem. That all, but his overall is not is good.
Okay, you're very kind. I know you're very kind.
All right.
Again,
Yes.
one of the comments that I notice the British candidates. If I tell you my name is John Stewart, can I call you John? Is that okay to continue? It's never happened with Egyptian examiner to familiarize with the patient. All right, John, what is the problem, John? Okay. And secondly,
Okay.
when you start write it down, you always have to write history down and you ask permission. Is it okay with you, John, to write some remark for you to remember your history and your condition? You ask permission before you write it down. I don't see candidate neither writing history down or taking permission or ask the patient which name they like to be called upon. And you mentioned the point of having pain score is essential. I think it's essential to mention how much pain does he have out of 0 to 10. Is it 9 or 7 or whatever? And again, when he make compassionate comment, when I said my friend has died, you feel it's a kind of acting. It's not really coming from his heart. And I learned this from lay examiner. I said, well, it's like putting a stamp. I have an empathy to you, but just let us get on with the exam. It's not feel like it is out of his heart. But anyway, I was hoping to continue the exam with him. If it was me, I would give him fail. Unfortunately, he need to really improve a lot. And what is really mistake for candidate 2201, he doesn't have a system to check all the history. You go to chest symptom, cardiovascular system, GIT symptom, urinary symptom, musculoskeletal system, neurological system. He doesn't have this system. He stops a little bit, and then what comes to his mind, let us ask about nausea and vomiting. What about nausea and vomiting? And then he stops a little bit. You can't feel that he's having, let us say, the check boxes for his history. Did you notice that, Professor Shireen? You're muted. Uh, you need to unmute.
Yes. Okay.
Yes.
All
Okay.
right. So I think you can take another student the same scenario. I think
Okay.
we have Matthew. He's from Malaysia. Matthew, are you hear us?
Matthew, do you like
Hi.
to
Okay.
jump in?
Yeah.
All right. So you can start. You can take a history. Matthew can take a history from you. Can see the difference.
Oh,
Okay.
brilliant. Okay, I will be the acting. You can
All
start,
right.
Matthew.
Okay. So you can start, Matthew.
Hi. Good evening. I'm Dr. Matthew. May I have your name?
Yes, my name is John Stewart.
Hi. Okay. Good evening, John Stewart. So can I get your age and what you present?
Yes,
What's the reason for coming?
I am a 65-year-old man, retired worker.
All right. Nice to meet you, Mr. John. So, can I know what brings you here today?
Yes, I have an abdominal pain in my lower tummy 3 days ago. Started when I was in my daughter's wedding. It seems to be getting worse, not getting better. So I came to hospital today.
Okay. First of all, I'm sorry to hear that you're having a tummy pain, and also second, I'd like to congratulate you on your daughter's wedding. So you're telling me about this tummy pain around your abdomen. It has been about 3 days. So can you tell me more about the pain? Does it go anywhere?
Yes, the pain is grinding pain. It's radiate little bit toward my back. It doesn't radiate anywhere else. And it's there all the time. Maybe when I get out of bed, it is maybe little bit less, but I'm staying in bed the whole day.
All right. I understand it radiates to the back and doesn't radiate anywhere else.
Yeah.
Does anything you do alleviate the pain or
No,
make
not
it
really.
worse?
It's like constant pain, and I can't really go to sleep, and it is getting worse. Today, I couldn't handle it. That's why I came to hospital.
All right. So you say it's really painful that you can't handle the pain. Can I get a score of 0 to 10 on the
Yeah,
scale?
I would give the pain now is probably 9. When it started 3 days ago, it was about 3 or 4.
Right. So it's gradually increasing. I will
Yeah.
try to do something about it. But before we go there, can I ask if you have any abdominal bloatiness?
No, no.
No. What about feeling of nausea?
I don't feel hungry. Maybe a little bit of nausea, but I haven't vomited at all.
All right. No vomiting. Any diarrhea?
No diarrhea. I didn't go to the toilet for the last 3 days.
Right. So it's only 3 days. So I don't think you probably have any weight and sorry, unintended weight loss.
No,
Can I?
no, yeah, no weight loss that I noticed in the last 3 days.
Right. I just briefly want to check out. Do you have any breathlessness or chest pain?
Um, I don't feel breathless, but my ability to work is diminished. But I don't
Yeah,
feel
visual.
breathless. Yeah.
Okay, and it's been over 3 days.
Yeah.
Just quick one. Does it affect your urinary? Do you have any problem urinating
Yes,
or
I've
like
noticed yesterday that I passed a very dark urine. Yes, only yesterday, not before.
so you do have dark urine as well? Okay, but no pain during urination.
No, no pain, no.
Okay. So you told me you're a worker. Can I know? Are you still working?
No, I'm retired
You're retired.
workman. Yes.
Okay. Can I also know briefly about your smoking? Do you smoke?
Yes, I smoke 2 cigarettes a day for the last 20 years.
Right. And you say you were having some alcohol at your daughter's wedding when you were having this pain. Do you drink alcohol regularly?
A couple of glasses every day, but not necessarily all weekends. Only 2 glasses a day. 2 glasses of a
Two
cherry a day.
glasses a day.
Yeah.
Okay. Also, I'd like to know if you have any allergy to any medications or food.
No, no allergy. No.
No allergy. No. Do you have any medical conditions that you're aware of?
Yes, I am diabetic, diagnosed this 3 years ago, type 2 diabetes, and I'm also
Right.
hypertensive in the last 10 years, and I take my medication.
Okay. You have to test it. Okay. I think that's about it. So I think that's it. So I'd like to summarize that you're
Okay?
okay. So I'd like to summarize that
Yes, please give me a summary of this patient history, Matt.
you're a 62-year-old retired worker who experienced abdominal pain at the upper region for the past 3 days, which is which what happened after he have had a couple of alcohols. at the daughter's wedding, and the pain was constant, radiating to the back, sorry, and it has been increasing on a scale of 3 to 4 to 9 at the moment. And there is there is nausea, but no associated vomiting, no bloatedness, and there's associated dark tea-colored urine. And the man has underlying type 2 diabetes and also hypertension, and is a smoker and also an alcoholic drinker.
Okay. And what do you think your initial diagnosis? Do you like to continue the examination, Professor Shireen?
No, I just, he's okay. He just forget what decrease the pain, and we in the script, we have decreased the pain by leaning forward. And when you ask about any medical condition, you need to enumerate. Are you in any medical condition like hypertension, diabetes, or dyslipidemia? But the second or the other is okay. So you can continue, Dr.
Okay. So what is your initial diagnosis, Matt?
My initial diagnosis would be acute pancreatitis,
Okay.
number one, and also there could be some liver involvement. So I'll be, and since the man is more than 40, drinking alcohol, I'll be thinking around cholecystitis, cholangitis, and I'll work up for this as well.
Yeah, okay. And what is your initial investigation? Would you admit this patient to hospital or not?
I would take blood investigation. I would admit this patient for further workup. So I'll take blood investigation, a full blood count, urea electrolytes, take the liver profile, and also more diagnostic of pancreatitis. I like to work up on the serum amylase and serum lipase. And moving on, I would like to take an AEG to see the patient condition, because it'll be only 3 days. There could be some sort of acidosis ongoing. And also I'd like to move on to imaging, so do a backside of a scan, so better ultrasound to see if there's any collection around the biliary, pancreatic, and the liver area. And also I'd like to, if needed, I'd like to proceed to an MRCP or even an ERCP if indicated.
Excellent, excellent, Matt. This is a pass. To me, this is a pass. You took history very well, although the point that Professor Shireen Hariri would decrease the pain, but you can get away. But in the last 3 minutes, other than you give a good summary in 1.5 minutes, and this skills is not easy to grasp, to summarize exactly where to pinpoint where is the problem, and you done it very well. And in the other 1.5 minutes, you did show me how much knowledge you have about pancreatitis. Also, there was 2 points was completely mentioned by the previous candidate. Didn't ask about alcohol intake or smoking, which is essential. Because I'm a smoker, and when the Egyptian comment about drinking 2 glasses of wine a day, they mention patient is alcoholic. This is totally wrong, because if you live in United Kingdom, this is most people will drink this. They are not considered alcoholic. Alcoholic is if you are addict to the substance. And this really will make the lay examiner to really get fussy about this name, because he probably, the lay examiner, drink 2 glasses of wine a day. So as if you are calling him an alcoholic. But you did show me good knowledge. You pinpoint what you want to do with this patient, and you definitely admit this patient to hospital, because if you send him home and this was acute pancreatitis, this is a fail for me when you have this condition. How marking are distributed, introduce yourself and get the consent is 1 mark, and you done this very well. Can I take a history from you? Can I call you John? I like this to get a little bit of social acquainted with it. And after that, history, we get 4 marks about the amount of history that you are going to have. And communication skills is 3 marks. You did show empathy about the wedding. I didn't send it to you that a friend of mine has died, but you already replied very well. And that's a straight pass for me. What's your opinion, Professor Shireen?
Yes, it is okay. Of course, in the exam, every point is recorded because an OSCE is a
Yes.
checklist exam.
Yes.
And each station, you have at least 2 mark out of 20 is sympathy or empathy with the patient. And
Yes.
usually in the scenario, we have something like good news or bad news, so you need to react with it.
Yes.
Okay. The main OSCE station is how to manage time. If you manage time correctly, you have the target, it is easy to pass.
Yes.
But who's fail in exam is bad management of time, so he don't take a time, he don't ask about history of allergy or social history or family history or other disease. So he lost in each 1 mark, 1 mark, 1 mark. So at the end, he have much losses. So it is very important to notice that. I think you can ask any other candidate, just ask him after diagnosis, not the history, and we can start one by one, start it from lab investigation, radiological investigation, and see the input. So any volunteer can open his mic and we can start what is your diagnosis and what investigation you will do.
Okay. If
You
anyone
can
want to
start,
volunteer,
Professor.
yes. If anyone want to volunteer, it's a great privilege to be examined by Professor Shireen Al Hariri. He has examined thousands and thousands of candidates. Anyway, it doesn't seem to be any volunteer. Let me take this chance, Professor Al Hariri.
Okay.
You've been
All
examiner.
right. Okay.
Yeah, you've been examiner in the Royal College of Surgeons in the last 20 years. If I want you to summarize your advice to Egyptian
Yes.
candidate who has paid 60,000 Egyptian pound, which is 1,050 sterling,
Yes.
and they want to
Yes.
work in United Kingdom, what you advise them to pass this exam safely? Let us have
Okay,
your
so
advice.
first he need to be calm. So if you are in stress at any time of exam, this is put be down because we suppose surgery is a stressful condition. So suppose you are stressed in exam, so the usually, especially the lay examiner and the communication skills, put you down even if you have correct answer. And you need to be sure because sometimes I ask you, are you sure? So you need to be confident and be sure. This
Yes.
is first. Second, during presentation, one of the communication skills, especially in the OSCE station and the communication skill station, you need to be eye-to-eye contact with the patient. The examiner usually behind you, don't look into the examiner. And body language or body response, you need to be much moving, just eye-to-eye for the examiner. Don't be leaning forward. It is better
Yes.
to be like this. And all this in the English culture, and we consider it. Maybe in other countries not considered, but your way, your presentation is considered.
This is
Second,
very important point, Professor Hariri. In my last
yes,
exam in Maadi Hospital, one of the examiner, which was from African country, he leaned forward so much that become his head near the chest of the actor, and we failed him just because of this. He doesn't have the body language to know you shouldn't be near enough to actor and shouldn't be far away as well. It's an intermediate, but this is very important point as well that you show. Yeah, please,
yes, it
Professor
is
Hariri.
important. It is if you're looking to the any announcer in the TV, especially TV news, you can find his attitude, how to make conversation.
Yes.
Usually in the college, we call this leaning forward is a stress angle. It means that you are stressed.
Yes.
Of course, some candidate he move his leg and
Yes.
become in stress. Any sort. Of course, it is a stress exam. I think you pay much, but if you are aware that you are stressed, usually you put you down because you know that English culture is different than maybe Middle East culture.
Yes.
This is first. The second, no need to say something in the slang, like don't ask the patient if your stomach hurt you, because the stomach is the stomach. The stomach is not the abdomen.
Yes.
We know it is exam, and the simulated examiner is usually professional. He work with long time. The exam is run about 20 times per year all over the world. So don't say like the first candidate water work or your stomach or all this. You need to speak in normal medical term.
Yes.
Last, of course, don't forget to summarize, especially in communication skills. At
Yes.
the end, you need to summarize. Don't forget to ask about other system. What happened in history taking station? Usually the candidate concentrate in the history, like it is acute pancreatitis, it is acute cholecystitis. He concentrate in everything in acute pancreatitis. But he can found one mark for or many mark for other system, like what is about your heart, what about urine, what any palpitation, have a mark. History of allergy have a mark. Social history have a mark. Family history have a mark. So you can find it is easy to lose 6-7 mark in nonsense, and you take a very good history. So some students take very good target history or focal history and forget to ask about other system. Okay.
Yeah.
We don't advise to say at the end what you concern, what they say, what you expected from us to do, because I see in many students, especially in Middle East, they ask the patient what you expected from us to do,
Yes.
what is your concern. It is not an answer at all. We don't do it in your country. If something you don't do in your country, like big country like Egypt or any country in Middle East, so it is not, we don't consider.
Yeah.
If you work an exam like in your country, so it will, you can easy to pass. If you make something is not logic, so it is not good. So it is
Yeah.
important
I
don't
was
to do that.
surprised, Professor Hariri, from the question at the end with this abdominal pain. What do you like me to do for you? Can you imagine, doctor, at the end? All the actors said was relieve my pain. And one of the questions, what do you think is wrong with you? And what do you expect us to do? All this question, I think they are being pushed to candidate from somewhere, and they get them wrong, totally wrong. And even if you think of logic, shall we say to patient, come to us, what do you want from me? I want you to relieve my pain, to show me what I have, to treat me. It's quite obvious. And this mistake is getting common and common. I'm really depressed with this mistake. Did you have the same feeling, Professor Hariri?
Yes, it is common, but usually nowadays we don't comment in any bad behavior or abnormal behavior of a student, because just to manage the time, to save a time.
Yes.
So I think if anyone other maybe can take Matthew again, we can ask him about investigation. We just start by investigation. So Matthew, what is the first investigation you do? This patient is well known that acute pancreatitis. What is the first investigation you will do?
So again, I'd like to proceed with a full blood investigation. I'd like to see the white cell count if there's any raised leukocytes.
Okay. So first he mentions that he looking for full blood count, looking for leukocyte. If you don't mention looking for leukocytes, so we take half a mark. After that, what else?
After that, I'd like to check the urea electrolytes and then also take the liver function test.
Which liver function test you are looking for if this patient is jaundice? Suppose it is jaundice.
All right, so I'll see the AST, the ALT, and also the ALP.
You mean liver enzyme?
Yeah, so the alanine transferase, alanine, AST, ALT.
Okay, so what is important in obstructive jaundice? If this patient obstructive jaundice, what liver function test you ask for?
So if there's obstructive jaundice, the ALP would be raised, and also the direct bilirubin would be raised as well.
Direct bilirubin is raised. So it is important to concentrate if this patient is jaundice, maybe not pancreatitis, in other case is direct bilirubin. What else in lab investigation?
The investigation, I like to take a serum amylase and serum lipase, which is mnemonic for the pancreas.
Okay. All right. What other radiological investigation we need to do?
Radiological, the most common would be the bedside ultrasound abdomen.
Okay, so it is important if mention ultrasound, you say abdominal ultrasound. We don't accept from you to say ultrasound. So ultrasound is not a correct answer. It is abdominal ultrasound. Suppose this patient is a gallbladder disease, what you looking for?
Gallbladder disease, I look for any stones, so any acoustic shadowing from the ultrasound, any dilated biliary duct. If there's more than 1 cm, so it will be slightly dilated.
Okay, in the abdominal ultrasound for gallbladder, you're looking for thick wall gallbladder, you're looking for pericholecystic edema, and of course, you're looking for dilated common bile duct. What do you mean by dilated common bile duct?
Dilated common bile duct would be when because there's a stone in the common bile duct, so the subsequently there's dilation below it. So it's
What is the normal? What is normal caliber of common bile duct?
normal would be around 6 mm.
Yes, it is 6 milli, and we call it dilated at what level?
More than 10 mm or 1 centimeter.
1 centimeter. Okay. So if this patient is obstructive jaundice, what else you do?
Obstructive jaundice, I like to do a MRCP or a ERCP if there's an access to it.
What is the difference between MRCP and ERCP?
So MRCP is just a magnetic resonance pancreatogram, so you're just looking at it, whereas ERCP is both therapeutic and also diagnostic.
How to come it is therapeutic?
It's therapeutic because if there's a stone, you can try to remove it and put on a stent for the
Okay.
dilated.
What is ERCP mean?
ERCP, sorry.
It is endoscopic
Endoscopic.
retrograde cholangiopancreatography. What is the complication of ERCP?
ERCP, the complication could be iatrogenic perforation to the pancreatic duct, or as an iatrogenic injury to the pancreas, or
Can be acute pancreatitis. Okay.
Yeah.
So how to score severity of acute pancreatitis in the patient described by Mr. Mohammed?
severity. I like to use the Glasgow-Emery criteria. So look at the pancreas, the mnemonic P.
B for BO2.
P for PO2. Yeah.
Yes.
A would be for the enzyme.
No, A for age more than 55.
Age more than 55. And
N for neutrophil.
neutral. Yeah.
And C for calcium.
Yeah.
R for renal function test. So
E.
N, C, R, E for enzyme, but not including amylase and lipase. It is liver enzyme.
Yeah.
What in
A
Spanish?
is
Pancreas. A again for albumin, acidosis, and M for sugar. So this is every prognostic factor or for acute pancreatitis. Okay. All right. If this patient have acute pancreatitis, what is the cause of this patient acute pancreatitis?
in this patient, it's likely alcohol.
What other cause of the acute pancreatitis?
It can be caused by obstruction, so any stones.
Any gallbladder
Any
stone
gallbladder
comes to
stone.
common bile duct. What else?
It can be caused by any infection.
Can be iatrogenic.
Yeah, iatrogenic,
Like
drug
what?
abuse, iatrogenic like ERCP.
ARCB. So the common nowadays is gallbladder stone go to the common bile duct or pancreatic duct, alcohol, and iatrogenic injury by ERCP. Of course, hyperlipidemia can cause some virus like Mumps or Coxsackie virus, but in most of the countries they have vaccination. So this is the common cause of pancreatitis. Okay, what is the complication of pancreatitis, acute pancreatitis?
Complication could be divided into early or late. So early, most severely will be ARDS, and also what's that?
What is ARDS mean?
ARDS.
It is adult respiratory distress syndrome. So it is important we can divide it to local and general. So local like acute pancreatitis become chronic, can be pseudopancreatic cyst, can acute hemorrhagic pancreatitis, and systemic effect can like organ failure like RDSA, adult respiratory distress syndrome, can be acute kidney injury, can be coagulopathy, can be hypocalcemia, can be multiple organ failure, and can be this. So pancreatitis also simple due to stone, but can cause a lot of complication and can cause this. Acute pancreatitis is important topic in exam because it is common disease. Alcohol is common in Europe, and the gallbladder is common all over the world. So it is important topic. And also we can modify the scenario, make it like acute cholecystitis or chronic cholecystitis if the patient have fatty dyspepsia or due to fatty meal and have pain. And at this time we can ask any one of the students, what is the character of the acute cholecystitis pain, apart from fatty pain or pain during fatty meal? What is the character of pain?
Any volunteer?
Anyone?
Yes.
Radiating the right shoulder.
Yes. So can go to the right shoulder. Okay.
I want to ask a question,
Also
Professor
related to
Shireen.
fatty meal.
Yes. You mentioned there are 3 or 4 stations that most Egyptians usually fail in. From your
Yes.
experience, what are these difficult 4 stations?
I think in the clinical is examine the cranial nerve, because
Yes.
cranial nerve is take a time, because we have a lot of cranial nerve and
Yes.
they waste the time in something unnecessary.
Yes.
The second, I think if he's not orthopedic surgeon, usually we have hip, knee, spine in the exam. So if the student is not orthopedic or no experience in orthopedic, usually it is the main problem. After that, the communication skill station.
Yeah.
And lastly, the critical care station, especially most of the students not aware much about arterial blood gases.
Yes.
This is the common, but the other station is easy for all. Examine
Yes.
the abdomen, examine thyroid, examine the lower limb for ischemia, suture techniques, surgical technique, all this is easy. So apart from orthopedic communication skills, the cranial nerve, I think is all is easy.
Okay. I would think every time we'll fix the time at 6 p.m. Cairo time, which is 11 p.m. Malaysia time. We'll select the days that you are free. Hopefully, we'll take 2 candidates per session. I hopefully we don't to cross 1 hour or 50 minutes, something like that, in order not to bother them too much. I think you concentrated a lot of very good question, and we have 2 candidates, and the difference in taking history was quite obvious. And I hope each candidate takes the courage. Let us volunteer. I have now 11 candidates being booked for virtual OSCE station. We'll go from history to examination to anatomy. We can do a lot of virtual, and if you have basic surgical tools, we can also do the surgical skills part as well. So thank you very much, Professor Shireen. It was a pleasure. Do you like
Is
to?
anyone of
Yes.
this team is entered the exam before, have experience about us or exam?
Yes, the first candidate, he told me he just failed 2 months ago. He was in Maadi Hospital.
Or okay.
And
Anyone have experience in exam? Just tell us.
okay. If anyone, he can unmute himself and speak. Have any of
Just
you
to
passed
see.
the exam or went to the exam before? No, I think.
Yes, hello. My name
Yes.
is
Yes,
Muhammad
hello.
Nabhan.
Yes.
Yes, I had my exam 2 months ago in Al Hospital too, and I didn't pass.
Okay.
Okay. What is the difficult station you found?
I think the communication skills phone call was the most difficult one for me.
Yeah.
Phone call usually, although it is a fixed, you know that we have a phone call exam. What is the station? It is about oliguria or about trauma?
It was about trauma. Vascular
Trauma.
trauma.
So can you tell us what you just take 5 minutes, Prof. Can you tell
Yeah,
us what
please
you
do.
tell the examiner? Suppose I am the examiner. So you are Dr. Muhammad Nabhan and you speak to me about the trauma. What you tell me?
I think it was a little bit difficult for me to gather all information in 9 minutes and to refresh it in.
No, it is. We don't need to have information. We need to tell us what you expected to tell. Just start with me. My name is Shireen, maybe different name for you. So just tell me, Dr. John. So what is your introduction? How to introduce yourself?
Number one, what
I
he means
introduced
is you
myself
must
like
you must know whom you are speaking to. So number one,
Yeah.
can I speak to the consultant surgeon on call today? Are you Mr. So? And then can I document it into the notes? Thirdly, it gather your skills. Now we have a station that you read the patient file for 9 minutes,
All right.
and it is
Okay.
yeah.
So
After that, you go to the phone station. Yeah.
okay. So at the end, Dr. Nabhan, you make a summary or not?
yes.
Yeah.
You make a summary at the
I
end.
don't think.
Yeah.
Okay,
I
so
don't
you,
think
you
that
need
it
the,
will make sense.
usually we ask if you make a phone call to any delivery company like KFC or whatever the company, the who takes the phone at the end he give you summary. So it is
Yes.
important. One of the common I see in the Middle East they forget to make a summary.
Yes.
So in this
Okay.
patient, can you start just to speak to me? You just tell me I am Dr. Nabhan Ari consultant. Just the beginning.
Hello, my name is Dr. Mohammed Nabhan. I'm
Yes.
ST1 surgical doctor. I'm just confirming that I'm speaking to the vascular consultant.
Yes, I am Dr. Shireen. I'm the vascular consultant. Okay, so what you need to tell me?
I really forgot about the scenario, so I
No,
will
no,
just.
we don't necessarily to forget to combine the scenario. Just tell I have a patient, how old he is, and I check and his airway, his breathing, his circulation, his vital sign, and I do to him chest X-ray, abdominal X-ray, and the fast scan. And is any problem in this
Yeah.
patient?
Anyway, I got a
Okay.
message from Google that will finish in a couple
All
of
right,
minutes.
okay.
So we'll
All
make
right.
the next station to be phone station.
Phone call.
Phone call
All right,
because
Thank you
I
very
really
much.
feel
okay.
bad that Mohammed
All right,
Daban, who
okay.
is a very good candidate,
Okay.
fail
All
for
right.
something simple. It's really simple, and
Yeah, yeah.
just
But
need the
it is
strategy
common
technique.
in Egypt to fail in phone call, by the way.
Yeah,
It is
yeah,
very
that's
common
true.
station for failure. Okay, all right.
So I
No
wish you
problem.
all the
Thank you all.
best, and hopefully we'll meet. We haven't fixed the date yet, but we fixed the time to be 6 p.m. But the date we'll see what Professor Sheen Hariri when he is free, and hopefully next time we'll discuss a phone station, and again we'll put you in a stress situation. I will give you maybe 9 minutes before to see patient notes in PDF file on the group on Telegram, and then you volunteer to jump in. Okay?
Okay, thank you very much.
Okay, all the best.